Okay, we have the federal health officials coming to give us an address about what is going on with COVID-19 in Canada. So please stand by while they get started.
We know that many Canadians are struggling to make ends meet. That is why today the Prime Minister announced that we're expanding our support for the Canadians who need it most. My colleague, Carla Qualtrough, will elaborate on this in a moment. Je sais qu'aujourd'hui, les Canadiens ont de la difficulté à joindre les deux bouts. C'est pourquoi je suis heureuse de pouvoir dire que nous assouplissons les critères d'admissibilité pour la PCE. Les Canadiens et Canadiennes sont résilients. Nous allons passer à travers ensemble. So today we are going to hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, Canada's Deputy Chief Public Health Officer, le Dr. Howard Njoo, our Minister of Health, Patty Hajdu, by video link, our Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough, et bien sûr, le Président du Conseil du Trésor, Jean-Yves Duclos. Dr. Tam, please.
Hello, everyone. Bonjour à toutes et à tous. I'll start, as usual, with our update on the number of COVID-19 cases in Canada. There are now 27,557 cases, including 954 deaths. These numbers change again throughout the day. For the lab testing, we've completed tests for over 462,000 people, with about 6% confirmed positive, as Canada continues to improve our testing to better track where the disease is spreading. As Canadians continue to practice physical distancing, we are closely monitoring for signs that our efforts are having an impact on the epidemic curve. It's taken just over 3 months for the first cluster of COVID-19 cases in China to spread globally and establish a pandemic. It is hard to take in how our lives have changed in such fundamental ways over this short period. At this point, we still don't have all the answers, but there is some cause for cautious optimism coming from our epidemiological data. Because COVID-19 is very contagious, even a few cases can quickly multiply, resulting in a steeply rising epidemic curve. This type of increase is referred to as exponential growth, with case numbers doubling every few days. In late March, when the growth rate was the fastest, we saw case numbers doubling every 3 days. But in recent days, we've observed a doubling time of over 10 days. This means the epidemic is slowing down. Though we all wish this could be a sprint to the finish, it is not. This will be a marathon, and there are no rewards for quitting early. To use another analogy, coming down from this epidemic curve will be like making our way down a mountain in the darkness. We mustn't rush or let go of our safety measures, or the fall will be hard and unforgiving. We need to remind ourselves that this is an emerging disease and that we don't know everything, so the terrain will be uncertain. That means we need to go slowly and be sure of our footing before taking each new step on the way down. Along the way, we'll need to closely monitor cases and growth trends to ensure we've got the right public health measures in place to detect and quickly respond to any new cases or clusters. We'll also need to maintain physical distancing during this time. Any break in our resolve could spark a new outbreak and delay our progress. So let's maintain our collective resolve and crush this curve. Thank you.
Thank you very much, Dr. Tam. Maintenant, je donne la parole à Dr. Njoo. Dr. Njoo, s'il vous plaît.
Merci. Bonjour. Commençons par le compte habituel des cas de COVID-19 au Canada. Il y a maintenant 27 557 cas de COVID-19 au pays, dont 954 décès. Ces chiffres changent tout au long de la journée. Nous avons mené des tests sur plus de 462 000 personnes, dont environ 6% ont été déclarés positifs. Le Canada continue d'améliorer les tests pour mieux suivre la propagation de la maladie. Pendant que les Canadiens continuent de pratiquer l'éloignement physique, nous surveillons de près les signes que nos efforts ont une incidence sur la courbe de l'épidémie. Il n'a fallu qu'un peu plus de 3 mois à la première grappe de cas de COVID-19 en Chine pour se propager partout dans le monde et créer la pandémie. Il n'est pas facile d'accepter le fait que nos vies ont changé de manière aussi fondamentale sur cette courte période. À ce moment-ci, nous n'avons pas encore toutes les réponses, mais les données épidémiologiques nous inspirent un optimisme prudent. Comme la COVID-19 est très contagieuse, même un tout petit nombre de cas peuvent se multiplier rapidement, provoquant ainsi une montée en flèche de la courbe épidémique. Ce type d'augmentation se nomme une croissance exponentielle et signifie que le nombre de cas double tous les 2 ou 3 jours. Fin mars, au moment où le taux de croissance était le plus rapide, nous avons vu le nombre de cas doubler tous les 3 jours. Par contre, ces derniers temps, un doublement de plus de 9 à 10 jours a été observé. En d'autres mots, l'épidémie ralentit. Certes, nous aimerions tous être rendus au sprint vers la ligne d'arrivée, mais ce n'est pas le cas. Nous sommes en train de faire un marathon et nous ne serons pas récompensés si nous arrêtons prématurément. Pour utiliser une autre analogie, sortir de cette courbe épidémique sera comme une descente d'une montagne dans l'obscurité. Nous ne devons pas nous précipiter ou abandonner nos mesures de sécurité. Sinon, la chute sera brutale et terrible. Nous ne devons pas oublier qu'il s'agit d'une maladie émergente dont nous ne savons pas encore tout, ce qui fait le terrain sera hasardeux. Cela signifie que nous devons y aller lentement et nous assurer de prendre un bon appui avant de faire chaque nouveau pas dans la descente. En cours de route, nous devrons suivre de près les cas et les tendances de croissance pour nous assurer que nous avons mis en place les bonnes mesures de santé publique afin de détecter tout nouveau cas ou groupe de cas et y réagir rapidement. Nous devrons aussi maintenir l'éloignement physique pendant cette période. Tout fléchissement de notre détermination pourrait déclencher une nouvelle éclosion et freiner notre progrès. Alors, maintenant notre volonté collective et écrasons cette courbe. Merci.
Merci, Dr. Njoo. And now, Minister Hajdu. Patty, please.
Thank you, Deputy Prime Minister. Bonjour à tous. J'aimerais vous parler aujourd'hui de santé mentale. Ça peut être difficile de garder une bonne santé mentale avec toutes les perturbations qui se passent actuellement. Ce n'est pas facile de garder une routine. La semaine dernière, nous avons parlé de modélisation, un exercice choc pour ce temps. Nous avons entendu comment le virus pourrait continuer à se propager au pays si on ne continue pas à suivre le Conseil de la santé publique. Living through a pandemic is not easy. Many people are struggling with fear, anxiety, and loneliness. And not being able to use our regular support networks or even practice our regular routines all across Canada means people are struggling. And they need tools to help, including with their mental wellness and health. So as of today, all Canadians have improved access to mental health supports through an online resource called Wellness Together Canada. You can check out this new suite of tools at canada.ca/coronavirus and through the Canada COVID-19 app. This resource has different tools available to meet the variety of Canadian needs. Whether it is anxiety, sadness, or substance use, there is something there for you. The options include an online peer community to talk and share and support others. There are also a number of self-help resources to help with anxiety, stress, or other issues. And there are options such as texting, calling, or connecting by video for a session with a professional to address a specific need. I encourage all Canadians to explore Wellness Together Canada, to use its resources, and to reach out virtually to loved ones. Now, more than ever, we need to stay connected. Thank you.
Okay, thank you very much, Patty. And now we will hear from our Minister of Employment, Workforce Development, and Disability Inclusion, Carla Qualtrough, joining us over video link. Carla, please.
Thank you, Deputy Prime Minister. Hello, bonjour. Comme je l'ai dit depuis le début, nous nous sommes engagés à soutenir tous les travailleurs touchés par la COVID-19. C'est pourquoi nous avons mis en place la prestation canadienne d'urgence. We recognize that under the current design, some workers don't qualify for the CERB, but are still in need of financial assistance, which is why we're expanding the eligibility criteria for this benefit so that it's more inclusive. As announced by the Prime Minister this morning, we are expanding the eligibility of the CERB to allow workers, including self-employed, to earn up to $1,000 per month while still collecting the CERB. To include workers who recently exhausted their EI benefits and are unable to find a job because of COVID-19, and to include seasonal workers who have exhausted their EI benefits and are unable to undertake their usual seasonal work as a result of the COVID-19 outbreak. Ces changements témoignent des différentes réalités auxquelles font face les travailleurs canadiens à l'heure actuelle. Nous savons que les gens souhaitent demeurer sur le marché du travail, mais ont vu une baisse considérable du nombre d'heures travaillées et des pertes de revenus à cause de la COVID-19. The changes announced today will increase the number of workers we can help, including those who still have some income but not enough now to make ends meet. The CERB will give them the extra support they need. We also know that Canadians, including many seasonal workers who have been collecting EI, may not have jobs to return to and are anxious as their EI benefits have either already run out or will run out soon. These people also need our support and will now be eligible for the CERB. We also want to ensure that our essential workers are supported during this critical time. They are working day in and day out at our hospitals, assisted living care facilities, senior and long-term care homes, and we know the sacrifices you're making to keep us and our loved ones safe. That's why the Prime Minister also announced that he and Minister Marneau are working with the provinces to provide a temporary top-up to salaries for essential workers making less than $2,500 a month. Nous savons qu'il s'agit d'un moment difficile pour beaucoup d'entre nous, et nous continuerons à chercher des manières de faire en sorte d'aider tous les Canadiens pendant cette période difficile. Je serai heureuse de répondre à vos questions. Merci, thank you.
Okay, thank you very much, Carla. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
Merci beaucoup, Christian. Bonjour tout le monde. Hello, everyone. Alors, ce matin, nous avons eu une importante annonce de la part du Premier ministre que Carla, la ministre Qualtrough, a très bien résumé. Une annonce qui met un peu les choses en perspective. Nous vivons depuis quelques semaines une urgence à la fois sanitaire et économique considérable qui a amené le gouvernement canadien à faire des choses qu'il n'a jamais fait dans son histoire. Et ça implique à la fois d'élargir et de resserrer le filet social que l'on a connu depuis la Deuxième Guerre mondiale. Et ça implique, entre autres choses, d'ajuster un élément majeur de ce nouveau filet social temporaire du gouvernement canadien, qui est la prestation canadienne d'urgence. Donc, des gens qui, autrement, n'auraient pas eu droit à la prestation canadienne d'urgence de 2 000 $ par mois, savent maintenant, avec l'annonce du Premier ministre Trudeau, qu'ils y auront droit. Ça inclut, entre autres, ceux qui ont perdu une bonne part de leur capacité de générer et d'obtenir des revenus, mais qui continuent à avoir des petits contrats. Ce sont beaucoup des travailleurs autonomes, ça peut être des artistes qui continuent à avoir un peu de revenus, mais qui ont beaucoup de difficultés à joindre les deux bouts, des gens qui ont perdu leur travail, mais qui ont des revenus partiels en raison de temps partiel. Ça peut être des élus municipaux ou des pompiers volontaires qui ont perdu leur travail principal et qui se retrouvent avec pas grand-chose pour joindre les deux bouts. Alors, l'annonce importante de ce matin, c'est que ces gens vont avoir droit à la prestation canadienne d'urgence et que l'allocation va être rétroactive au 15 mars dernier. Un autre exemple de gens qui s'inquiétaient de leur capacité de prendre soin de leur santé et de nourrir leur famille, ce sont les travailleurs saisonniers, comme le ministre Qualtrough l'a dit, et aussi les gens qui ont perdu leur travail au cours des derniers mois et qui sont en train de perdre ou qui ont déjà perdu leur prestation d'assurance emploi, c'est-à-dire depuis le début du mois de janvier. Ces gens-là vont aussi être admissibles à la prestation canadienne d'urgence. Et en terminant, bien c'est aussi une pensée et une action très importante pour ceux qui travaillent dans les services essentiels au Canada et au Québec en particulier, ceux qui travaillent très fort pour prendre soin des aînés en particulier, qui travaillent dans des conditions exigeantes, mais qui gagnent moins que 2500 $ par mois. Alors le Premier ministre Trudeau a annoncé ce matin que l'on a aussi ces gens-là, lorsqu'on a lorsqu'on pense à aider tous les Canadiens et tous les travailleurs. Donc, ces gens vont recevoir une aide additionnelle du gouvernement fédéral qui va leur permettre de continuer à donner l'aide dont on a besoin pour tous les aînés et pour tous les autres qui ont besoin de ce travail. Alors, voici Christian.
OK. Merci Jean-Yves et on est prêt à répondre à vos questions.
Okay. Merci Madame la Vice-Première ministre. On va commencer par 3 questions au téléphone. Start with the phone, 3 questions, and then turn to the room, 1 question, 1 follow-up. Operator?
Merci. Thank you. Please press star 1 at this time if you have a question. Appuyez sur l'étoile maintenant si vous avez une question. Notre première question nous vient de Marie Vastel du Devoir. À vous la parole, please go ahead.
Oui, bonjour Monsieur Duclos. Justement sur la PCU et les annonces d'aujourd'hui, ma première question, ça serait de savoir, vous estimez à combien désormais la facture totale de la PCU maintenant qu'elle a été élargie et combien de personnes supplémentaires vous pensez vont s'y qualifier suite à l'annonce de ce matin ou de ce midi?
Merci pour la question. Des précisions supplémentaires vont être apportées par la ministre Qualtrough et le ministre Morneau. Mais ce qui est important aujourd'hui là, et cet après-midi, c'est de comprendre là, que ce filet social dont on a absolument besoin, qui a été élargi au cours des dernières semaines, on en resserre les mailles pour faire en sorte que les travailleurs essentiels puissent être appuyés davantage. Au Québec, on sait à quel point c'est important. Le gouvernement du Québec l'a déjà annoncé au cours des derniers jours. Mais on pense aussi aux travailleurs saisonniers qui sont aussi très importants dans l'Est du pays, au Québec en particulier. Ces travailleurs saisonniers qui, normalement, seraient sur le point de retrouver un travail, mais dans beaucoup de cas, ne pourront pas le faire. Et on pense à ces petits travailleurs avec des travailleurs avec des petits salaires, des travailleurs autonomes qui ont beaucoup de difficultés parce qu'ils ont perdu à peu près tous leurs contrats, qui n'en ont maintenant que quelques-uns. Donc, on a aussi ce matin là, l'assurance de la part du premier ministre Trudeau qui vont pouvoir continuer à garder quelques petits contrats tout en recevant la prestation canadienne d'urgence.
Suivi, Marie?
Well, maybe Minister Qualtrough can answer my first question then, and then I'll ask my follow-up at the same time. So my first question was, what is the total bill that you estimate the new CERB will cost, given that it's been expanded to include more workers? How much now do you estimate it will cost? How many more people do you estimate will qualify for the CERB now with those changes that you've announced today? My follow-up then is concerning the hiking of the salaries for essential workers. Can you clarify which essential workers you are looking at? Is it just for long-term residences, or is it other sectors? Is it only health sector? Can you clarify? And will Quebec also get money from that top-up, given that they've already started topping up their own essential workers' salaries?
Well, thank you for those questions. First of all, with respect to the number of workers and the costs, that will, it's a little premature to estimate based on the fact that we don't know the uptake yet of the wage subsidy. We really want employers to hire people back. We want people to switch back from the CERB to the wage subsidy. So right now we're estimating that while the expanded eligibility criteria will indeed allow more people to access the CERB, there will be less people on the CERB once the wage subsidy is fully implemented, because ultimately we want people to go back to their work, to their jobs, and be connected into the labor market as we transition out of this. In terms of the essential workers piece, I'll defer to the Deputy Prime Minister, because I know that her colleagues, Minister Morneau and herself, are working with provincial territorial governments on this issue.
Thank you, Carla. And on the top-up for essential workers, this is an effort that we are working on collaboratively with the provinces. The Prime Minister first broached it with the premiers at on the First Minister's call on Thursday. There was an enthusiastic response, and since then I've spoken about it with a few premiers. The Prime Minister has continued to be working on it, and the Finance Minister has been working on it with his colleagues. The Prime Minister intends to make this one of the key issues that we discuss and hopefully come to a resolution on quickly at the First Minister's call with the premiers tomorrow. So the idea is that this would be done collaboratively by the federal government and the provinces. Tu as raison, Marie, que le Québec a déjà fait beaucoup dans cet enjeu. Et vraiment, je peux dire, et le Premier ministre a dit ça le jeudi passé, que le Québec a donné un bon exemple pour le fédéral et pour toutes les autres provinces. Et évidemment, le Québec ne sera pas pénalisé pour l'avoir fait déjà.
Thank you, Deputy Prime Minister. Operator, next question, please.
Notre prochaine question nous vient de Philippe Vincent Foisy de Radio-Canada. À vous la parole. Please go ahead.
Oui, bonjour. J'essaie de comprendre, avec l'armée dans les CHSLD, je comprends qu'il faut attendre une demande des provinces que Québec n'a pour l'instant pas fait, à moins que je me trompe. Mais j'aimerais savoir ce que vous, le gouvernement fédéral, offrez comme aide aux provinces avec l'armée concrètement, là, à part des médecins militaires. Qu'est-ce que vous pouvez faire dans les centres d'hébergement de soins de longue durée pour les provinces?
Bien, merci pour la question. Évidemment, les forces armées canadiennes ont des capacités très variées. En passant, on a tous compris ce matin de l'annonce de M. Trudeau qu'il y avait aussi une opération des forces armées avec les Rangers dans la base Côte-Nord. Donc, on sait là, que ce sont pour des activités davantage logistiques pour assurer le déplacement, pour faciliter le travail collaboratif entre les municipalités et pour appuyer aussi les services de sécurité dans cet environnement où il y a à la fois peu de gens mais un grand territoire. Pour la question des plus spécifiques des contextes médicaux, donc des CHSLD, évidemment, on pense surtout à l'usage des capacités des forces armées en matière de santé. Les forces armées canadiennes ont effectivement des capacités d'intervention et d'appui importantes en matière de santé, mais comme on le sait, ce sont des capacités qui doivent être en appui à celles des provinces et des territoires, et donc fournies à la suite d'une demande spécifique du Québec dans ce cas-ci. Mais concrètement, c'est un peu ça la question. Je veux dire, concrètement, qu'est-ce que vous pouvez faire? Qu'est-ce que les forces peuvent faire? Puis, à quel moment elles pourraient être déployées? Si Québec le demande, par exemple, demain lors de la conférence, est-ce que ça peut être fait cette semaine? Parce qu'à chaque jour où on attend, il y a des gens qui meurent. Là. Ce qui est absolument important, c'est de le faire en collaboration et en appui au travail des provinces. On sait que le Québec et toutes les autres provinces travaillent très fort dans la situation d'urgence sanitaire que nous connaissons. On sait que c'est très difficile dans les CHSLD à travers le Canada et certainement au Québec. On sait que le gouvernement du Québec travaille fort pour essayer de faire en sorte que tous et toutes ont les soins dont ils ont besoin. Donc, c'est vraiment une capacité d'appui. Et c'est pour ça que la réponse, c'est que les forces armées sont là pour aider, mais sont là pour aider dans un contexte où c'est le gouvernement du Québec, dans ce cas-ci, qui prend le leadership et fournit des demandes spécifiques aux forces armées.
Merci, Monsieur le ministre. Opérateur, prochaine question, s'il vous plaît.
Merci. Notre prochaine question est de Michel Lamarche de TVA Nouvelles. À vous la parole, please go ahead.
Donc, M. Duclos, je poursuis là-dessus très rapidement. Pouvez-vous confirmer qu'il n'y a pas eu de demande de Québec? On sait qu'il y a des discussions pour l'intervention des forces puis de la division médicale, mais il n'y a pas eu de demande précise de la part de Québec à ce moment-ci. C'est bien ça?
Effectivement. Il y a donc des discussions très importantes qui ont lieu, comme à beaucoup d'autres égards, là, entre le gouvernement du Québec et le gouvernement canadien. Il est possible que ces discussions mènent à des demandes bien spécifiques. À nouveau, ces demandes bien spécifiques vont toujours prioriser le contexte dans lequel le gouvernement du Québec va vouloir, s'il le souhaite, que les forces armées canadiennes et les appuis médicaux des forces armées canadiennes s'inscrivent dans le contexte plus général de la gestion des services de soins de santé en CHSLD.
Et je peux préciser, jusqu'à ce moment-là, on n'a pas eu une demande de ce genre du Québec.
Ma deuxième question, ce serait pour le docteur Njoo. Docteur Njoo, on sait que la réflexion, elle évolue par rapport aux masques obligatoires un peu partout dans la société canadienne. Vous en êtes rendu où dans cette réflexion-là, est-ce que vous pensez qu'au cours de la semaine, Santé Canada recommandera ou forcera les gens à porter ce masque partout lorsqu'ils sortent de la maison?
Merci pour la question. Oui, on sait que c'est un enjeu actuel. Je pense que c'est quelques jours, la semaine passée, j'ai oublié, c'est quelle journée aujourd'hui, que le Dr. Tam et moi, avec nos homologues de le comité consultatif spécial, ont eu une bonne discussion. Et à date, c'est encore un conseil, on dit c'est permissif. C'est pour les masques non médicaux, il faut vraiment distinguer pour la population générale. Avec l'enjeu actuel pour les masques on dit médicaux, parce qu'il faut absolument consacrer les masques médicaux comme la protection, l'équipement de protection individuelle, le N95 pour les travailleurs de soins de santé. À part de ça, pour toute la population générale, c'est toujours une option. On dit que si quelqu'un sort de la maison, seulement si c'est nécessaire, et il y a peut-être une possibilité, c'est pas possible de garder un éloignement physique de 2 mètres, peut-être on rentre dans un transport en commun ou peut-être dans une épicerie. Oui, c'est toujours une option, mais c'est toujours aussi pour protéger les autres. C'est quelque chose qu'il faut vraiment distinguer. Si on porte un masque non médicaux en public, c'est vraiment parce que vous pensez c'est quelque chose la personne peut faire pour peut-être protéger les autres. C'est pas vraiment une protection contre les autres. Et ça s'est pas changé à date.
Merci, docteur. Okay, we'll turn to the room, starting with Julie, CBC.
Julie Van Dusen, CBC. Dr. Tam, when you said the epidemic is slowing down, my ears kind of perked up. But is there any reason to get optimistic about this when it doesn't sound like there can be any change in behavior?
Yeah, I think what I said was cautious optimism. I think what we're doing is working, and you're seeing that slow down. But I didn't say we reached the peak. And I've always said on the other side of that peak, you have to be really vigilant. If you do not, then you experience a resurgence. We've got many challenges still to deal with, including managing the outbreaks in long-term care facilities, etc. So I do think that the epidemic growth rate has slowed for sure, but the main message for all Canadians is actually not to let go. Lâche pas la patate, comme je dis avant, is just, this is not the moment to let go. You're doing a great job. Let's continue that until we can get to the bottom of that hill and then look at what that new normal would look like.
Okay, and I guess my second question would be for Mr. Duclos, or perhaps the Deputy Prime Minister. We talk a lot about nursing homes, and it seems to be a lot of talk and not a lot of action. Canadians are devastated by what's going on in there, especially those who can't visit their loved ones. We all know that we would never let a pet suffer this way, much less a loved one. So you call it a war, and a lot of people are wondering, where are the soldiers? Why don't you send them in? Perhaps with the help of the Red Cross on a humanitarian mission to serve meals, to help out just during the pandemic. What kind of possible bureaucratic excuse could there be not to?
I'll start, and certainly the Deputy Prime Minister could add if she wishes more. I first of all agree with your assessment that we have to do a better job collectively as governments, and I think this is no secret to people, as I said yesterday, who have experienced a loved one who's lived in long-term care. There are a variety of different levels of long-term care, but some of them are quite atrocious, as you pointed out, and I think this is an opportunity for all of us at all levels of government to reflect about how we will do a better job. In terms of our immediate response, I've had conversations both with my both counterparts, Minister Elliott from Ontario and Minister McCann from Quebec, to talk about how we can support them in the short term, including as we've mentioned, resources to top up wages for long-term care workers so that they have what they need to stay in one place and not have to work in multiple places over multiple sites, but also in helping them with the significant human resources crunch that they're facing right now. And so Health Canada has, as I think I announced a couple weeks ago, a portal that thousands of Canadians have applied to help. And so we are working closely with both Ontario and Quebec to match them with the appropriate resources to support them in long-term care homes and other ways that they might need within the healthcare system. And in fact, just checked with my deputy, and there's about 1,000 people right now that would be available to support Quebec that speak both official languages. So that work is happening right now. And I think there's two stages. There's a short-term stage, which is doing what we need now to actually put the tangible pieces into place that will protect people living in long-term care homes, but also people working in long-term care homes. And then secondly, how we work together to build up a much more humane system for all people who are aging in Canada.
Okay. Marika?
Marika Walsh with the Globe and Mail. I'm just wondering, this is either for Dr. Tam or Minister Hajdu, how many warehouses or stockpile locations do we have for the National Emergency Stockpile across Canada? And how has that changed, say, in the last 20 years? Has it gone up or down?
I think I'll turn that to Dr. Tam, as I, believe it or not, before the pandemic was the Minister of Health for a month and a half, so I don't have the history that perhaps you're looking for. So perhaps Dr. Tam does.
Yes, so I think in the past decades, the NES actually stockpiled a lot of things like cots and blankets and that type of material. Those were sort of reduced over time because other people can provide some of those, but we still deploy them. And they are scattered across the country. And we have at least 5 regional warehouses for general supplies. But the national stockpile over the years has been much more focused on stockpiling very strategic medical supplies that nobody else actually holds. And those are very specialized, and it's held in one single warehouse, basically, where there's very specialized conditions to maintain those medications or vaccines.
So can you just confirm, does that mean there are a total of 5 warehouses in Canada, and what was the highest number? And my follow-up question is on CBC's reporting that the warehouse in Regina was closed and that masks were thrown out. Were those masks replaced, and why was that specific warehouse closed?
I asked my officials that question this morning when I also read the story about the destruction of expired masks in the Saskatchewan warehouse. And we'll be reviewing the practices of what we do with equipment that is near to expiry, because I believe there is probably a more effective way to use equipment that is nearing its expiration date. Certainly that was pre-pandemic, and I understand the reluctance of Public Health Agency of Canada to distribute equipment that in any way has expired in normal times, because of course the first focus is the safety of the people that will use that equipment. But there may be opportunities to, and I'm certain actually there's opportunities to look at a process where that equipment is offered either, first of all, to parts of Canada that may not have easy access to that equipment, and if not, then overseas to other countries that may need it. So we'll be reviewing that practice. The number and nature of the warehouses, I will get back to you on that information. I take Dr. Tam at her word that it's 5, but we'll confirm for you.
There's some locations where there's more than one actual physical building, but there's essentially, but we will absolutely verify that, because even for me, some of those changes because of logistical requirements, but definitely confirm that.
Thank you, Doctor. Annie?
If I could just ask and one more thing. When I asked about the nature of the warehouses early on, I will say that they are considered to be an issue of national security. So releasing the exact location of warehouses is not a practice that the Government of Canada has ever had, because, of course, these are strategically important resources during times of pandemic or other kinds of disasters.
Hi, it's Annie Bergeron-Oliver with CTV National News. My question is for Dr. Tam. The percentage of people who were testing positive seems to be increasing. In the first week of April, we were around 3.5%, and at that point you said that was a good range for Canada to be in. Now we seem to be hovering around 6%. I'm wondering what attributes for this change in the percentage and whether Canadians should be concerned that more people appear to be testing positive for the coronavirus.
Yes, I think the percentage positive is a combination of different factors. One is how the provinces are targeting the testing. So obviously targeting high priority situations where there are outbreaks, that will get you more percentage positive potentially. But what we want is a sensitive enough system where significant numbers of people perhaps with milder symptoms are still being tested. So you still have 94% that are not positive. So it shows that the country is still testing a lot of people who in the end didn't turn out to be positive, but that shows a certain amount of sensitivity in the system. But that's also a composite of the country. So those might be different depending on the location or the jurisdiction because of their different epidemiology as well. So it's a combination of things. I think globally, what is suggested is anywhere between 3 to 12% is the sort of range that people have been using as a system that has a sort of right balance of targeting the right population, but also being sensitive as well. But we, as we've all said, we need to improve the lab capacity in Canada, and we're going to continue to do that.
Okay. As a follow-up, every day it seems like we're hearing more cases of healthcare workers who are being infected. And I'm wondering, one, if you have an exact picture of how many healthcare workers across the country are currently infected. And two, what is the federal government doing to ensure that hospitals have the staff they need as more healthcare workers get sick? And the same goes for long-term care facilities.
Well, first of all, and I'll turn to Dr. Tam to speak about specifics in a minute, but I will say that the work that we do at the federal level around staffing of hospitals and process and protocols for hospitals is at the technical guidance level. Dr. Tam and Dr. Njoo, as you know, sit on the Special Advisory Committee, which is comprised of all of the public health officers from across the provinces and territories, and it is there where the guidance gets developed in partnership with all of those experts across the country. The federal government has provided a number of resources. I always say that we are able to provide money, which we have, to provinces and territories. We are able to provide equipment, which we have, to provinces and territories, and guidance. And that is really the role of the federal government. And of course, any other extra special requests that each province and territory poses, like, for example, human resource support, we are working very diligently to provide that as well. I don't know if that's complete enough, but I can certainly give it to Dr. Tam to speak a few extra words.
I think it is actually quite important to look at the number of cases in healthcare workers, which the provinces have much more detailed information on. Of the provinces that have provided us with information that we can glean, the percentage of cases that have been in healthcare workers ranges somewhere between sort of 7% to sometimes 11%. In general, and the exposure setting, if you like, is actually quite varied. A lot of them are actually infected not at the workplace. Sometimes it's due to travel, attendance at a conference, attendance at certain mass gathering events, and certainly into the more social context as well. So I think what that tells us is, of course, we need to protect healthcare workers, both at the workplace, but it is also important for them to reduce all of their risk of acquiring infection elsewhere, I think, as part of their other daily life as well. So I think both aspects of protecting healthcare workers are important. Of course, travel and mass gatherings have now been considerably reduced. I know of even one cluster where it involved a funeral setting where there were some healthcare workers as well. So it's actually quite varied in terms of where they acquire infection. We know to date of one health worker who had unfortunately died with COVID-19. It is unclear, I think, where that worker who is, I think, an environmental staff, had acquired the infection. It may not be the workplace, it could be in the community, but that's sort of under investigation by the jurisdiction itself. So I do think that it is something that we are monitoring, I think, in every area of Canada very closely.
Thank you, Doctor. I want to turn back to the phone for 2 last questions. Operator.
Thank you. Our following question is from Jim Bronskill from the Canadian Press. Please go ahead, à vous la parole.
For Dr. Tam, it seems many say that a rapid testing capacity that's many times what we have in Canada right now is a requirement for a return to anything like normal. First, do you agree with that? And if you do, can you lay out in detail what's being done to get us to that point?
So I think certainly when there are bigger outbreaks or clusters, you can be what you're testing is trying to determine if an outbreak is occurring, and looking at community transmission. When we get to epidemic control of the first wave, which is our collective objective and our goal, you have to have sensitive laboratory testing. You have to have good testing systems so that you can detect any reigniting, if you like, and the sparks and clusters reoccurring. So for sure, ramping up our capacity in anticipation of that period of time where we have to detect further chains of transmission is very critical. So we are doing this in a number of ways. One is every single day looking at every avenue to increase our capacity to do the detection for the virus, which is mainly the PCR test. So those are the tests that could be done in bigger laboratories, but also smaller ones. But then the rapid test that can detect the virus as well. So absolutely pursuing that, including, of course, domestic supplies such as the Spartan company that is providing. This is one that Health Canada had recently approved. So trying to get as much of that diagnostic on board, and that would be really a sort of great component of our strategy for those who are more in the remote and rural areas, indigenous communities, because that will eliminate the transportation time for any specimens. But for sure, any of those types of tests we're pursuing. Making reagents, ensuring we have swabs, all of those things are being worked on every single day by every laboratory. We have to thank the laboratory people, by the way, today, and all that they're doing to help us in this outbreak. Also then, of course, we are examining the antibody tests. And people have asked us that, about that in the past. And we are actively testing some of those kits, doing quality assurance, making sure that they can actually detect antibodies, and then further understanding the immunology of the virus. So I think all of those streams of capacity building are relevant.
Thanks. And for Minister Hajdu, what do you make of the U.S. President's comments about the World Health Organization and the withdrawal of funding? How will this affect the fight against COVID-19?
Well, I think Canada values the work of the World Health Organization, and we continue to commit to contribute towards the work of the organization. It is a very valuable tool when in regular times, in both its ability to detect new virus activity, to manage outbreaks of a variety of different diseases around the world, to bring scientists and researchers together, to allow the capacity for countries to work together to deal with these types of outbreaks. And so we commit on a regular basis through the presence of Dr. Tam as one of the expert advisors to the committee, this special committee on COVID-19. And we know that any response to COVID-19, and in fact, really any global outbreak, is one where countries have the capacity to work together and to pool their research and to really share their efforts to manage these outbreaks that will happen again and again and again, by the way.
Thank you, Minister. Operator, next question, please.
Thank you. Our following question is from Lauren Gardner from Politico. Please go ahead, à vous la parole.
Thanks for taking my question. The Prime Minister said yesterday that border restrictions are going to be needed for weeks. Many states in the U.S. have extended stay-at-home orders. How long is Canada looking to extend the current limitations in place for non-essential people not crossing the border?
Thank you for the question, Lauren. Well, you will have heard from Dr. Tam and Dr. Njoo that they are cautiously optimistic when they look at the doubling rate of coronavirus in Canada. And I would just like to echo their comment that Canadians have been great and really disciplined. And I am so grateful to Canadians for their excellence in committing to physically distancing, and that does allow us today to be cautiously optimistic. You've also heard from our public health officials that we recognize in Canada that we still have a considerable way to go, and we are going to be absolutely vigilant and fierce about not squandering the tremendous sacrifice that Canadians have made and not squandering what that sacrifice has accomplished. So, and I'm just so grateful to Canadians who have been so terrific, and everyone has made a sacrifice. And I'm really pleased in a cautious way that we are able today to say that we're cautiously optimistic. That is really precious. That is hard won. And as you heard from our public health officials, we are going to be very careful and thoughtful about how we move from here. We're not going to waste the hard work that people have done already. In terms of what that means on the border, as the Prime Minister has said, as I said yesterday, Canada believes that we need to extend the restrictions that we agreed to with the United States in a really terrific collaborative process last month. And we are working with our American colleagues to do that. We think it's premature to set a specific date and to promise that for sure this will be the day when things can be lifted and we can go back to normal. But we have a really great collaborative relationship when it comes to the border and many, many other things. And those restrictions that Canada and the U.S. put in place at the border really, really are working. Travel is down a lot, which is the right thing. And at the same time, essential travel does continue.
And for my follow-up, I know you can't give a specific date as to when things will return to normal, but could you, Deputy Prime Minister, and maybe also Dr. Tam, talk about what you would need to see both in Canada and in the U.S. for these types of restrictions to be loosened, even if not fully taken away?
So I think our singular focus is to get epidemic control of this initial wave. So I think we must absolutely stay focused on that. We're not close to that. And so I think you cannot emphasize that too much. Of course, we'll be closely monitoring the epidemiology on both sides of the border because once you get the epidemic wave or epidemic control of the initial wave, we won't be back to completely normal. We know that the Canadian population is not going to be immune. There's a lot of people that's not going to be immune. And whatever we get back to is not going to be the same as before the actual pandemic. As to what that new normal might look like, we have to just tread cautiously in order to sort of get there. But so then after that, one of the key risks for igniting chains of transmission, of course, then becomes importation. which means that we have to watch that really carefully and have all the measures such as the mandatory order that we had put in place yesterday, not just for symptomatic but asymptomatic travelers to undergo the periods of quarantine. So all of those, this kind of systematic capacities you have to put in place before you can do anything else. And I think, as I said, having all those preventive measures, making sure our health system is ready should there be any resurgence, making sure that when we talked about our noughts, we're looking at the sort of effective reproductive number so that there's no ongoing expansion of any further introductions is extremely important. So we need to get that laboratory capacity up. We need to make sure case contact management is strong. All of our domestic wave is epidemic controls underway, and our population is fully prepared before we cautiously look at some of those next steps. So that's at least the public health advice.
Yeah, and the only thing I would add is, we have been managing the Canada-US border in a remarkably collaborative and reciprocal way. And I think it's a really good example of good neighborly behavior. In introducing these restrictions, we have been protecting each other. And that is going to be the approach that we continue to take.
Thank you, Deputy Prime Minister. We'll take one last question on the phone, and then Mike will come to you. Operator?
Thank you. Our next question is from Lina Did from La Presse Canadienne. À vous la parole. Please go ahead.
Pour vous, Madame Freeland, on voit que les conservateurs continuent d'insister d'avoir un retour en personne aux communes, même en petits groupes. S'il n'y a pas d'entente, la Chambre doit être rappelée lundi. Est-ce que vous contemplez la possibilité d'une prorogation ou pas du tout?
Nous sommes tous très conscients de l'importance du Parlement et de l'importance de l'opposition, toujours, et surtout dans une période de crise. C'était une bonne chose d'avoir un débat au Parlement samedi. Pablo Rodriguez, notre leader dans la Chambre, est en train de discuter ce que le Parlement pourra faire en avenir avec les leaders dans la Chambre des autres partis politiques. Je sais que nous avons une bonne collaboration avec tous les partis politiques. Tout le monde comprend que c'est un moment de crise et on doit travailler ensemble. Et je veux seulement ajouter que tout le monde est aussi conscient qu'on doit être très, très consciente que nous avons une obligation de protéger la santé, pas seulement de nous, les membres de la Chambre des communes, mais aussi de tous les travailleurs qui travaillent ici et qui nous permettent de travailler ici.
Donc, sauf que vous ne répondez pas à ma question, est-ce que vous contemplez ou pas une prorogation? And my other question is for you, Dr. Tam, about the doubling every over 10 days. I wonder how reliable that number is when you consider the very small amount of testing that Ontario is doing. Why are you relying on that data?
Lina, je peux seulement ajouter que on est en train de discuter l'avenir de la Chambre des communes. C'est une discussion dans laquelle les leaders sont les leaders de tous les partis dans la Chambre. Notre gouvernement comprend l'importance du Parlement, l'importance des partis politiques de l'opposition. En même temps, on est consciente que on doit protéger la santé de tout le monde, absolument, incluant les gens qui doivent être ici dans la Chambre des communes pour nous permettre de travailler.
Yes, so in terms of the growth of the epidemic, this is at the national level, and as I think I've pointed out before, that this is a composite of actually many different epidemics across the country. So you're correct. You need to sort of look at the individual provincial piece as well. And we're always cautious about this. This is only one component of what we look at. But what I can tell you is that our daily testing rates haven't gone down. I mean, they are continuing to, be sustained or improved upon. Every province, including Ontario, is trying to increase their testing. So that actually has not come down, while the epidemic growth rate itself has actually, the length of time has grown, which means it's slowing down. So that's why we are being cautious, very cautious as usual. And a phrase that I use, and I don't know where I got it from, somewhere anyways, is that we're cautiously not entirely unoptimistic. So that's about where I think we're at, but it is only one element of all the dynamics that we look at on a daily basis. Thank you.
Thank you, Doctor. Mike.
Hello, Mr. Duclos. Has the federal government received a request from the Manitoba Premier Brian Pallister to allow non-frontline provincial government workers to qualify for the employment insurance if their work time has been reduced because of this?
Well, I'll turn, if that is fine, Mike, the question to Minister Qualtrough, who is probably on top of this important question.
I thank you for your question. We've had a number of public sector employers reach out to see how they can be supported, either through EI work sharing, through perhaps the wage subsidy. And I know that there's ongoing discussions at various FPT tables, in particular about how we can perhaps work to some resolution of this, but there's been no decisions made. I know the conversations are ongoing, and I don't know if the Deputy Prime Minister has anything to add.
What Carla says is an accurate reflection.
Okay. And is this something that's workable in the long run, or is that still under discussion?
Under discussion.
My quick answer to that would be under discussion.
Okay, thank you. Merci. Ceci met fin à la conférence de presse.
Hello again. I'm Peter Van Dusen.